me what your health was like and what you were seeking.
I was on medications for high blood pressure, high statins, high triglycerides, really high. The medication was not bringing it down. I was exercising some, lost, confused, and extremely tired.
You even had gout, right?
I had gout, outbreaks. I was taking medication, sometimes 2 different medications for gout.
So this was not going so well,
It was
right?
going horribly. I was grumpy with my child. I just didn't have the energy. So found Dr. Arter, put me on a program, chiropractic. We did complete testing of my body, more testing than doctors had ever done.
And how do you feel now?
Incredible. Incredible.
Really?
I can come home, I take bike rides, I'm exercising. And it's not like, oh, I got to exercise. It's like, let's go for a bike ride.
And medications done?
Medication. I'm off all medications, and all those numbers that were really high that we were trying to get down with statins and other drugs are all in the normal zone now.
So Dr. Arter, this is just a matter of really being a problem solver, right? Figuring it out.
You got to find out what's going on. I mean, if there's plaquing in the arteries, there's tests for that. If you're pending heart disease or heart attack, stroke, there's tests for that. Not a lot of doctors will do those tests. For Ben, we did that, but it also came with a blueprint.
My doctor said you're overweight, your cholesterol is high, your blood pressure is high, and you're pre-diabetic. About that same time, my wife had a presentation from Dr. Arter and Dr. Kramer from Thrive at her place of business. She said, I'm going to go and have an assessment, and I'd like you to come as well. So I did, and that's how we got started. In addition to those things that I already mentioned, I also was having limited mobility. I'm in my early 60s, and I'm starting to lose energy, and also some mobility in my shoulder and pain in my lower back. And I thought, well, this is just part of getting old. When I went in and talked with Dr. Arter and had my first assessment, he said that's not part of getting old. There's some things that are not right. The good news is that we can work on them. And in the process of increasing your flexibility and increasing your energy, we can also probably deal with your pre-diabetic condition and lower your cholesterol and probably affect your high blood pressure. So it turned out that during the course of treatment, we were able to do all of those things. Part of our treatment was to go through a 60-day dietary cleanse. But during that time, I lost 30 pounds. And when we had the blood test at the end of it to compare it to our initial blood test, my A1C count was back in a normal range for the pre-diabetic condition. My blood pressure was the lowest it had been in 30 plus years. So back into a normal range. First time it had been normal in that time. And my blood pressure was back down within a normal range as well. So I'm looking forward to going back in May to my next annual physical, presenting all this information to the doctor, because she had told me that if I didn't do something, that I was going to be placed on some medications. I'm looking forward to not being placed on medications.
I work hard, I have a physical job, I was tired, I was not sleeping, I was not resting, and I have a family history of high blood pressure and heart disease that I was very, very concerned about, emotionally concerned about, and wanted to sidestep, and was looking for any answers to that.
So Dr. Arter, what do you do with a patient like Rod? What do you look for?
Well, we do advanced testing, and it's not just so much to say, okay, we think it must be this or we think it must be that. We actually cast a broad net, and we do a wide spectrum test, find out how healthy you are, not just how sick you are. So we want to know what makes a healthy human being, and then put in place what's missing or take out what shouldn't be there.
So get you back in balance,
That's right.
get everything working.
It's all non-drug, non-pharmaceutical, non-surgical. It's food, it's supplements, it's a protocol that's custom built for you.
And how has that changed your life, Rod?
And it's changed my life immensely. In 9 months, I have got a huge amount of energy back. I'm sleeping at night, I'm dreaming again. I have the power now, the knowledge and understanding how to go forward and to sidestep the heart disease and the blood pressure issues in my life. And the energy is just, it's amazing.
Incredible.
High blood pressure, cholesterol, acid reflux,
Oh my
osteoporosis.
What was life like for you?
It grew to be very miserable and hard to deal with.
Okay, so then I know you actually happened to see Dr. Arter on this program.
I did.
And you went to visit him. So Dr. Arter, what were you able to help Gary with?
Well, we were able to get to the root of those issues and find out really the gravity of those issues. His cholesterol problems were not just cholesterol problems. He had inflammation in the arteries. He was pending stroke or heart attack within the next 5 years.
Oh my gosh.
We also could see that, there was food allergies and inflammation in his gut that were causing a lot of inflammation in the arteries, the lungs, everywhere else too.
And so now, how do you feel, Gary?
I feel blessed to have a new lease on life. I'm feeling great. I'm able to do things that a 40-year-old might do.
Wow, and probably finally feel like you belong in your own body.
Absolutely.
Yep.
Take back control of your life and call Thrive Health Systems now for a free consultation.